So when you receive your Biolitec laser from Menequis, I'm just going to run through a few of these accessories which you receive in the box. So the first thing is the laser foot switch cable, which you can see here. Secondly, your power cable, your laser warning sign, your foot switch, your protective eyewear, your laser handpiece, your laser fiber, your fiber stripper, very important remote interlock, and your ceramic scissors. So we're now going to cover connecting the foot switch cable with the foot switch. It's important that we align the groove on the foot switch cable to the groove on the foot switch itself. When connecting the cable, it's important, after having aligned it, it's a push fitting and then a rotation clockwise. The next stage is to connect the remote interlock. You can see it has a red dot at 12 o'clock, and this must be aligned with the port on the laser. It is vital that this is not lost, because the laser will not function. The next stage is to connect the remote interlock, and you do that by supporting the laser as so, connecting it and aligning the red dots, then getting the foot switch cable, aligning it at 12 o'clock and putting the bracket down as follows. And finally, connect your power cable as shown. The next stage is to connect the fiber to the device. Firstly, remove the protective cap as shown. Then we're going to connect the fiber. Remove the protective cap and connect as shown. It's also important to remember to replace caps both on the fiber and the machine in between horses. After having powered the laser on, simply enter the password 1234. And now we're going to cover some of the features of the laser. This is the mode, which is in standby in its current safety feature mode. We've got the aiming beam, which is green, red, and blank. The mode which the laser is set in, which is continuous at the minute. You've got treatment energy and treatment time. And finally, the little cog in the corner here, which if I press that takes you into the treatment settings. And now we're going to run through the presets of the laser. If you hit the cog in this bottom right-hand corner, you can see here we've got them in here for oncology, sarcoid 1, sarcoid 2, scarification, and hemostasis. And you can move in between settings as shown. And also, if you want to override, you can hit the wheel again, and you can actually move the axis to your preferred settings. Hit the tick box and it will override the system. If you want to override the setting for upper airway procedures, simply do as follows. Move the axis to a desired setting, hold the push button in here, the tab, release, and then you can change this setting here to URT. Hit the tick box and you've overridden it. The next stage is to insert the laser fiber into the handpiece as shown. Once the fiber is in the optimum position, secure as shown. This is the optimum length of laser fiber, which should be outside of the laser fiber pen. You can see here we've got 2 or 3 mil of unstripped fiber and 3/4 centimeter of stripped fiber. If we have the fiber as so, that creates too much flexibility during procedures. If we draw the fiber back to here, that can sometimes fuse to the laser fiber pen, which is a no-go. The Leonardo has 3 aiming beam options: off, red, and green, which is extremely helpful for contrast. So this is the method to change the aiming beam intensity and the color. Simply go to the following. To change color, do as so. And to change intensity, do as shown. To activate the laser, hit the standby button and wait for the ready symbol. To activate the laser, release the foot switch cover and depress the laser foot switch. We would also recommend to cut and strip the fiber every 300 seconds or 5 minutes or between sarcoid sites.